for a minute, I will be talking on oncoplastic surgery for breast cancer, median survival, median 36-month follow-up results. Before embarking the paper, I need to thank Dr. Shahriar Kallol, who also in these works, and he already presented many of the cases, and we share many cases. That's why many photograph will be same as we both work in the same institution. So this is our disclaimer. Our talk will be divided into some big picture of FCPS, glimpse of our works, and 36-month results and conclusions. You all know the horizontal plastic surgery. This is the combinations of integrations of scientific principles of oncological surgery with aesthetic techniques of plastic surgery. So the goal of oncoplastic is better cosmetic outcome, avoidance of mastectomy, and overall satisfaction and quality of life. So there are some issues like merging local recurrence, oncological outcome, delayed in adjuvant therapy, and missing recurrence. Fortunately, all the issues are largely addressed and worked by the oncological surgery. As you see, regarding margin possibility, the clear distinct margin possibility is more than that of the conventional conjugal surgery. And in other cases regarding recurrence, overall survival, and distant metastasis, all are same or superior than that of the conventional surgery. There are multiple levels, level 1, level 2, level 3, and level 4, you know all. And for surgical perspective, we can divide into volume replacement, there is level 1 and level 2, when it is level 3 or level 4, this is usually volume replacement. So let's see, before seeing the results of 3 years, some of our works. As you know, we perform all the surgery quadrant by quadrant. For our first quadrant, we do battery or hemi-battery mastectomy, mammoplasty. This is after 3 months down the line, 9 months down the line of surgery. For upper and inner quadrant, matrix rotation techniques. 3 months down the line. Lower inner quadrant, mammoplasty. Perioral 2 months, we perform round block, we see that, you know. Crescent maxillary, embedded mammoplasty. 3 months down the line, 7 months down the line, 24 months down the line. For lower outer quadrant, mammoplasty. Recent mammoplasty for central quadrant. Or sometimes we do keyhole dermoglandular flap. For outer quadrant, we do like so various techniques starting from round block to the keyhole mammoplasty. So let's see the results of 3 years. We have performed 58 cases starting from September 2021 to February 2022. And we have adopted 14 techniques, and our median follow-up time is 36 months, ranging from 30 to 38 months. Our endpoints was first-species, primary first-species, local recurrence or all other recurrence, disease-free survival and overall survival. The secondary endpoint was quality of life. If we go some demographic result, then we see that our average age was 39, and starting standard deviation was 11.37, and range was 22 to 73. And the third decade was the highest of the patients. And for regarding the patients, you see more than 60% patient is below 40 years. For outcome variable, for cosmesis, we use the 4-point Likert chart. For recurrence, we look for local, regional, or distant metastasis. For quality of life, we look for body image, fear of recurrence, patient satisfaction with treatment, and cosmetic results. For cosmetic result, you see that for ipsilateral shape, we have divided in four categories: poor, fair, good, and excellent result. And you see that ipsilateral shape, we have 4-point ipsilateral shape, cleavage, curve visibility, and symmetry. And in cosmesis, we found good result in 32 patients. 19 patients for excellent result was 33 patients. And as a whole, 52 patients, that is 90% patient was good or excellent result for cosmesis. For recurrence, we find 2 patients in local recurrence and 3 patients in regional, 1 patient regional, and local distance there was 2 patients. As you show already, for the central quadrant tumor, we have done one keyhole shape dermomedular flat. After 21 months, the patient comes again to us with axillary lymph node recurrence. And in these particular cases, we primarily done the sentinel lymph node biopsy. Now we perform the axillary dissection for this recurrence. We find the local distance recurrence in terms of local recurrence in the breast and distant metastasis in the lungs and vertical mesh also. So, and that patient, this is another patient. We after 29 months that we will perform the inverted tomography, the patient again comes to us with a scanning lesion in the nipple. We do biopsy, and that's come into PASI. And finally, we excise the nipple, and finally report also PASI. And another recurrence, this is also the local recurrence, and this patient come to after 35 months. This patient come to us, and this patient primarily done with matrix rotation. The patient come for local recurrence, and we perform the local recurrence. The patient undergoing mastectomy right now. So our recurrence rate is, if you consider all the local recurrence or local distance or regional recurrence, is 8.6% recurrence. Regarding quality of life, for body image shape, you can see that for fear of recurrence and patient satisfaction, and for cosmesis, you will see that for body image, we found satisfactory result in 57 patients and 99%. Fear of recurrence was 20% satisfactory, and for satisfaction treatment, we got 48 patients, that is 84% was satisfied, highly satisfied with this positive. And finally, the positive results, the patients, 80% patients, that is 46% were highly satisfied. We estimate the 3-year survival rate, disease survival, we got 91.4% patient was 3-year survival rate, and disease overall survival is 96.6% was we found 3 years overall survival rate. So finally, we can conclude like this. Oncology surgery is safe and feasible for non-invasive breast cancer patients, and it should be the standard of care in breast cancer surgery by its applicants. It is still under practice, though it offers better cosmesis without compromising oncological safety. Basic oncology to advanced oncology to extreme oncology is an learning curve. Thank you.
Thank you, sir.